All right. So I want to paint you a picture and see how many of you in this room can identify with this. You wake up in the morning and you think to yourself, I'm so tired. I'm not going to work out today. Maybe tomorrow. Or you go into your kitchen and you tell your family, please don't talk to me, not till I've had my first pot of coffee. You come on into work, brain fog, trouble focusing. Maybe you finally get to lunch, lunchtime. Only by the time you're done eating, you feel worse than when you started. And you think to yourself, you know what, I should just start skipping meals because I always feel worse after I'm done eating than when I'm started. And then you get to the end of your day, made it to the end of your day where you should be excited to go home, spend time with your family and friends, only you're too tired to enjoy them. Finally, you get to go to bed, and now you have energy. Now you wake up. Now you have trouble falling asleep. Or what about trying to lose weight? Struggle to lose it, finally get it off, only it all comes back maybe plus a few pounds. And the more times you do that, the harder and harder it gets to get the weight off. Does that sound familiar to anybody? Any of those things? Yeah. It's very common. Probably 95% of the people I treat have these complaints. But what if instead you woke up with amazing energy every day, excited to go do your workout, and your workouts felt great? You could eat every meal with no pain, no bloating, no gas, no acid reflux. You get to the end of your day with energy left over, excited to enjoy your family. And weight loss is easy. You don't have to count calories. So there is a way to achieve all of these things. So in order to get to that place where I explain how that happens, we're going to lay some groundwork. If you were driving down the road in your car and your check engine light came on, what do? Hopefully, you take your car to the shop and say, hey, look under the hood, figure out what made this check engine light come on. When the light goes out, you expect that your car is fixed. Now, would any of you instead pull over to the side of the road, find the fuse in your fuse box that controlled your dashboard lights, pull the fuse out, and keep on driving down the road, expecting everything to be okay? Now, that sounds completely crazy, but every day, this is what people are doing with their health. Arguably your most important asset, way more important than your car, yet most people treat their cars better. So if anyone that you love or yourself is suffering with something like high cholesterol, and you're just taking a pill to make the cholesterol go down, but you don't know why the cholesterol went up in the first place, you're just pulling that fuse. What about acid reflux? You're just taking the Tums, the Rolaids, the Protonics, but you don't know what caused the reflux? Same thing. We're pulling the fuse. What about headaches? Painkillers, ibuprofen, Imitrex. But you don't know why you have headaches? What are you doing? You're just managing symptoms. So I could go on and on about most of the conditions people suffer from, and we have become so conditioned to accept that as health care. And it doesn't have to be allopathic medicine only. People do this with vitamins too. Lots of people go into vitamin shops and let somebody with a high school education tell you what you should take for this symptom, right? But nobody's figuring out what's causing those symptoms. So they're continuing to get worse while we're just making the symptoms go away. And most people in their life reach a point where they feel like that snowball going downhill, gaining speed, and their health is getting worse and worse. That's because they've been ignoring these conditions for so long. So people are getting sick and tired and overweight. And I absolutely believe it's because we're doing this with our health. We're pulling those check engine lights and we're not treating root cause. So tonight, in the next series of lectures I'm going to be doing here, we're going to be talking about root causes, what can be causing some of these conditions and why it's so important that we treat them at the root cause level, not at just the managing symptom level. So a very common one that I see all the time is gastric disturbances. So probably 95% of Americans have some sort of GI complaint, whether it be constipation, diarrhea, acid reflux, colitis, GERD, you name it. Lots of people have problems, or just bloating by the time they're done eating. This is a really big problem because this area is so important to your health. Your GI tract is where most of your immune system lives. And if you believe in any sort of intelligent design, that makes sense because you're going to breathe or eat everything into the human body. You want it to pass through your immune system. Unless we're putting all kinds of crap down this tube and we're having all kinds of complaints in this area, now we're hurting our immune system every time we eat. Every time we take that laxative, every time we take that Rolaids or that Pepcid or the Tums, instead of fixing what was causing the problem, your immune system's in trouble. So there's really no surprise that autoimmune illness is going up like crazy in our country, whether it be autoimmune thyroid, chronic fatigue, fibromyalgia, lupus. Autoimmune illness is going up because our immune systems are in trouble. The other really important thing that happens in your GI tract, this is where you absorb your nutrition. So how many people have been tested or have at least seen on the news how prevalent low vitamin D is? You've been told you have low vitamin D or low B12. Well, it's not because we're not eating enough food in this country, right? We've got plenty of food. So how is it that we're so malnourished? And let me tell you, vitamin D and B12 are really just the tip of the iceberg. Because I do a test where I look at all of the vitamins and minerals all at one time, because to me it's way more about the balance in the body and not just the specific numbers. So I want to know how calcium and magnesium are in relation to each other, etc. So I do this test a lot. I have only tested 2 people in thousands of patients that didn't have vitamin and mineral deficiencies, and I was one of those people. So I know how prevalent it is. And again, it's not because we're not eating enough food, it's because we're not absorbing what we're eating. Because we're taking so many protonics, we're taking so many Tums, and acid is in your stomach for a reason. Acid is there to help you break down your foods so you can absorb your vitamins and minerals, so you can absorb your nutrition. And then your intestines are where that nutrition is then absorbed through. So if you have constipation and diarrhea, that's not happening either. So no surprise, we have lots of malnutrition. And those vitamin deficiencies are very significant because they contribute to fatigue, insomnia, arthritis, certainly weight gain. You pick any condition, it gets worse when you're malnourished. So why is this happening? Why do we have so much problems in our GI tract? Toxic food syndrome is a big part of that. So what is toxic food syndrome? Toxic food syndrome is when you put a food in your body and it makes you feel worse than when you didn't eat anything, right? You get worse by eating that food. It's creating some problem for you. So many of you have probably heard of gluten. Gluten, yes. Gluten is just one food that we can test for. We can test for hundreds of foods, right? So it's way more than just about the calories. It's about how these foods treat your body once they're on the inside. And on some intuitive level, you probably know that. Because if I told you to eat 1,200 calories in a day, but on this day, I had you eat all junk food, fast food, cookies, junk food. This day, still just 1,200 calories, but you had free-range beef, grass-fed beef, free-range chicken, organic fruits and vegetables. Same amount of calories. Which day do you feel better and lose weight, right? So it's not just about the calories. It's how these foods are signaling your DNA once they're inside of you, what they're doing to your immune system once they're inside of you. And that's why gluten is such a big deal, because when you consume gluten, if you have a gluten problem, your immune system attacks it. And that's what happens with all these other foods that we can test for. The way the test is done is they put hundreds of foods in individual wells, they put your blood in on top of it, and then a computer watches to see if your blood attacks that food. So think about the power of that information and for you and your health, right? Every time you ingest that food, if it's creating that level of an immune system response and inflammation, now anywhere the blood goes can have problems. So when I do this test, I see amazing things for my patients. Anything from arthritis going away, seizure disorders going away, weight loss easy, migraines gone. You can't even imagine the power of getting the diet right. It's huge. So that test helps me put foods in the right category for my patients. Do almonds need to go in the category with cookies and Snickers bars? We don't know till we do the test, right? What if it's squash or tomatoes? Foods that you're relying on for you to be healthy and lose weight all of a sudden become your enemy. That's a really big deal. It's a really big deal. For myself, I suffered with migraines for years, and I was in search of how in the world can I have migraines? I do everything right, nutrition, working out, chiropractic, acupuncture, but I still had migraines. So that's what led me to doing this test years ago. And when I did my own, I had a problem with tomatoes and black pepper. So black pepper, being a spice, you can imagine how difficult that would have been for me to figure out. Because sometimes I thought, wow, that steak caused a migraine. Sometimes it didn't. Wow, that asparagus caused a migraine. Sometimes it didn't. It was whether I put pepper on that food or not, or whether it was marinated in a spice that had pepper. So finding that out changed my life. So that's when I started actively speaking about this, because it just can change lives. It's so very important. So that test to help people figure out which category to put foods in, a huge win for everybody's health and for weight loss. But there's another whole category of foods, and those are the foods that are bad for all of us. So those foods, a very, very important one, trans fat. Any biology teachers in the room? No? Okay. So every cell in your whole body has a phospholipid bilayer around it. Okay, everybody remember that from a freshman biology class somewhere? So what lipid means, fat. So whether it's an eye cell, ear cell, blood cell, doesn't matter. Every cell in your whole body has a membrane around it that's made of fat. That means to you, whatever fats you ingest in your diet that day are what the cells are going to be made of in your body that day. So all of us have millions of cells dying off. We're making millions of new cells. And what if that day you stopped at Starbucks for breakfast, school cafeteria for lunch, maybe Sonic for dinner? Or worse, what if it's the children you teach are your own children who are making billions of cells in a day? That's what all those cells are going to be made of, those kinds of fats. So what kind of fat is that? Trans fat is a hydrogenated oil. That means they take a beautiful, natural, fluid oil, and they go through an industrialized process where they slam it full of hydrogen. Those hydrogen bonds then make that fat incredibly rigid, okay? The point of this process for manufacturers is to increase shelf life. So the bugs and microbes won't eat this fat, okay? That's why this food can sit on the shelf for years without molding. They won't eat it, but yet we're putting it in our bodies over and over and over. And if anybody saw that movie, Super Size Me, the best part of that movie was after it ended and the credits had rolled, they did this segment where they left a McDonald's hamburger sitting on the counter, and they put it next to a homemade hamburger and fries, and then they took pictures of it every day for months and months and months. Within a few days, the homemade hamburger covered in mold and bacteria. They were digesting it. McDonald's hamburger and fries never got touched. Not in 6 months. And if you're a parent and you had kids that ate McDonald's in your back seat and you're cleaning out your car and you find that half a burger or French fries months later and it looks just like the day you bought it, maybe a little dried out, but just like the day you bought it, that's why. It's because of things like trans fat that increase shelf life that are in these products. So most of the processed foods on the shelf and all of the fast food has these chemicals in it as flavor enhancers and to increase shelf life. But they are killing us. Those foods have to go in the category of never ingesting. So if a patient tells me, well, I only have fast food, once or twice a week, that is huge, huge problem. And many, many people tell me that they have it once or twice a day. If you told me once a year on a road trip, I'd go, okay. But daily, weekly, think of all the cells in your body that are made of these rigid fats, right? And so eventually, a majority of your cells, majority of your children's cells, can be made from these fats. So those brains don't think very well. Those blood cells don't carry oxygen very well. All of those cells do not communicate with your hormones well, including insulin, estrogen, progesterone, testosterone, thyroid hormone. They don't communicate with those cells because the receptors are trapped in a rigid membrane instead of a nice flowy membrane like it's supposed to be. This is a really huge deal. So, most important top food to get out of your life, trans fats. Now, manufacturers have figured out that we're looking for that word. So now they have often started putting hydrogenated canola oil or hydrogenated whatever, corn oil, trying to make it sound better and more healthy. It's hydrogenated oil of any kind. It is a trans fat. They've also figured out that they're allowed to not put it on the label if it's a low enough percentage of that food. So one of the ways they're playing games is with serving size. And they do this with gluten as well. So if you're looking at a food that has an insanely low serving size, you know, a bar that says 3 servings, when you know for sure that is one meal easy, they're playing with serving size so they don't have to declare something on the label. So that's a big warning to you, okay? Another really bad chemical in the category of bad for all of us is MSG. MSG stands for monosodium glutamate, and glutamate is one of those chemicals that goes to your brain and fires it up, inflames it. So a lot of these ADD, ADHD kids, autistic kids, this makes them just crazy. Those are the days that the parent's just like, I don't know what was wrong today. It's usually either a food dye or MSG. But it's bad for all of us, not just people that live on that fringe that already have issues. Anybody with ADD, ADHD, MSG is going to make it worse. And MSG is in a lot of stuff. Again, it's a flavor enhancer that's really cheap for manufacturers. So again, they're trying to hide it because they've learned that people are looking for that word. So if you see on a label, natural flavorings or natural seasonings, that is code for MSG. So when you read labels, you're thinking, oh, natural flavorings, natural seasonings, this one must be okay. No, they're putting MSG in that category, so they don't have to write it out on the label. If you look at a label, it needs to say every single ingredient, no mystery potluck ingredients that they can hide a bunch of stuff in. And you need to know what every word on that label means. If you don't recognize it, you probably shouldn't be putting that food in your body. That's the easy, short answer to what is this chemical, what is this? Don't eat it. It is that easy, and it is that important. So, also in that category of things that are bad for all of us, high fructose corn syrup. Really big deal. High fructose corn syrup, way more glycemic than regular sugar. It hijacks your body and goes straight to your liver and goes straight to fat. So you can parallel the introduction of high fructose corn syrup into our diets with diabetes. They go just like this together. High fructose corn syrup makes you fat, makes your blood sugar go crazy, and is incredibly addictive. So you will see it in almost all children's foods, even children's vitamins, and certainly in soda pop. All of your soda pop today is now sweetened with high fructose corn syrup, unless you buy the special Dr. Pepper from Dublin where they say they make it the way they used to. Then it just has regular cane sugar in it. But everybody else, it's high fructose corn syrup. And high fructose corn syrup, huge problem. So start looking for that on labels and get it out of your family's life. There is nothing good at all that can come from high fructose corn syrup. So anything that raises your insulin level is going to make it harder to lose weight. So insulin is that chemical that gets released by your pancreas, or hormone that gets released by your pancreas, that then helps your body process sugar. So if insulin is elevated, your body is in the process of burning sugar. Your body will either burn sugar or it will burn fat. It does not do both at the same time. So if you want to remain lean or you want to lose weight, one of your main objectives needs to be you keep your insulin levels low. And you do that by eating low glycemic foods. So all over the internet you can find charts that list glycemic index. That's a way to actually compare an apple to a turnip. It tells you what a number is, and that's how much it hijacks your blood sugar and how much it's going to make your insulin go up. So the higher the glycemic index, the worse it is for your blood sugar. So you want to keep your glycemic index numbers low. So for a healthy person, below 50. For somebody who's trying to lose weight, below 25. And what you're going to find when you look at glycemic index, there's actually a lot of fruits that will be way above that number. And there's a lot of reasons for that, but part of them is so many of our fruits are now genetically modified that they're much sweeter than they used to be 20 or 30 years ago. So a lot of oranges, much, much sweeter than they used to be. So their glycemic index is going up.
Get back the level again.
Below 50 if you're a healthy person, below 25 if you're trying to lose weight. So the objective is to keep your insulin levels low. So some things that will raise insulin really quick are the foods that we call the whites. And that's why they say the whites are bad for you. That's white rice, white potato, white bread, is because of what it's doing to your insulin. It's making your insulin go up. You're burning sugar, not fat. So diet products, a lot of people think that they're doing the right thing when they're drinking Diet Coke, anything with aspartame or NutraSweet in it because there's no sugar. The problem is your mouth still perceives how sweet these diet products are. So you ingest something like Diet Coke. Your brain says, okay, here comes a big whopping load of sugar, pancreas, get ready. So it starts releasing insulin to get ready. Only now, it gets to your stomach and into your bloodstream, there's no sugar because this is a no-calorie sweetener. So the cognitive dissonance that it's creating between your brain and your body is a big deal. And not only that, but now you have insulin running loose with nothing to work on. So it gobbles up what little bit of blood sugar it can find and drives you into a state of low blood sugar. So the next time you eat, you're going to crave the wrong foods for starters. You're going to want to reach way more for the candy, the bread, the pasta, the rice. And when you do, it's going to overshoot your sugar. So those products put you on a blood sugar roller coaster. And that's bad. That's bad for a lot of reasons, but certainly weight loss. It's also bad for brain fog and energy. Blood sugar's going up and down, really bad. Diet products, they're supposed to be helping you lose weight. They do the opposite. And then there's another whole argument to be made about NutraSweet and aspartame and the fact that they cause cancer. So there's been a lot of studies that show that they do. So there's also been some studies that show that they don't. I wouldn't risk it. It's absolutely not worth it. So here's what I tell my patients. If you want to consume a no-calorie sweetener, there is one that is safe that we know does not cause cancer, and that's stevia. Okay? So if you're going to have a glass of tea or coffee that you want to put a sweetener in, and you're ingesting it with a meal that has calories to it, then you can use stevia in that glass of tea or coffee. But if it's in the middle of your day, no food with it, I don't even want you to use stevia in that coffee or tea because it's the same blood sugar problem. It's still something very sweet with no sugar for it to work on once it gets in your bloodstream. So if you're having that glass of coffee or tea in the middle of the day, I would rather you use a whole sweetener like honey or maple syrup or coconut palm sugar. There's a whole sugar like turbinado, raw sugar that hasn't been processed and bleached. Much safer for your body. Now again, if you're having it with a meal or even just with a snack, if you'll just have a handful of nuts or something with that, then you can use stevia in it. Okay? You just have to have something for that insulin release to work on. Does that make sense? All right. So we're going to play a little game. We're going to figure out which category, whether this is going to cause inflammation and be bad for you or be good for you, each one of these foods that I have brought in. So we'll start with an easy one. Good or bad? Very bad. Absolutely right. What about? Yes. Very good. Yay. High fructose. Very good. You guys are really great. Yes. Most people get ketchup wrong all the time. They're like, it's a vegetable, right? It's made from tomatoes. No, there's no vegetable left in here. I can assure you of that. Apple? Good. Apple juice. Even if it's Snapple? Yes, yes, you are exactly correct. It's just plain cheese. It says natural.
How much sugar does that have?
Well, this one, it does not have sugar, but I don't know if any of you know it, but cow's milk is white. Cheese should be white. They have added dyes to make cheese yellow. These dyes, really bad for us. Look for the white cheese, right? Then there's a whole conversation to be had about dairy, but that's a very long topic. It is one of the foods I test for in food allergies and sensitivities, so I can tell you for sure whether dairy is good or bad for you. And we'll just have to take it from there. But you can buy the safest, healthiest cheese, till we figure out whether you have a dairy problem, is raw cheese. And you can buy that in the grocery stores. Raw cheese is from healthy, pasture-fed cows that they take healthy, organic milk from so that they can make the cheese raw. So very clean. You'll never find it yellow. It will always be right, whether it's raw cheddar, raw mozzarella, raw whatever, okay? Lots of them available at Sprouts, Central Market, Whole Foods. And what you'll find with the raw cheeses, they taste way better than any cheese you've had before. You will be hooked. Raw goat, raw sheep, raw cow's milk cheese, all of them. Fantastic. Really, really good. All right. Next. Yes, exactly. You can't believe how much sugar are in these, right? So unfortunately, what's passing for health foods is low fat, high sugar. Because we have been lied to about fat. If I'm picking what I want you to eat to help you lose weight, to help you be healthy, it's going to be whole, normal fat and low, low sugar. Because all of those cells we talked about that all need healthy fats, your brain is half fat, your myelin sheaths around all of your nerves are made from fat. You need a lot of healthy fat in your diet. And when you're eating fat, your body will stay in ketosis. It will burn fat, which is what you want. You want your body to burn fat. So all of these health food products, they've taken out the fat and they've put in carbs and sugar and high fructose corn syrup. That is not a good trade-off, not at all. And fat, by the way, is what makes you feel full. So all these people on low-fat, high-carb diets that stay hungry all the time, because they never get satisfied. Your body's waiting for that signal to the brain that says stop eating. It gets that very quickly from fat. It doesn't get it from carbs for a really long time, okay? All right, how about this one? Yes, that's exactly right, even a healthy choice. Everybody thinks they're doing a really great thing. No, no. You look at this, there's a whole bunch of chemical names on this label that you do not recognize. You know you're in the wrong place, a whole bunch of foods you don't recognize. Easy one, absolutely. We had to have a few good ones in here because the bad stack. Ensure, it's what they give patients in the hospital, people coming home for physical therapy. Lots of old people live on Ensure and Boost and drinks like it. Horrible. So if any of your family members are living on this stuff is horrible. So I do lectures at a cancer center near my office. That was one of the first things I had to educate those cancer docs on. This is what they were giving their patients after chemo without even thinking about it. Of course, they don't do that anymore. We've had a long conversation about these. This is nothing but sugar, water, and chemical. Horrible. Very, very, very bad choice.
Is there something you can recommend to replace that? Because I do have elderly parents that live on that stuff?
Making them liquid food is a much better thing to do.
Like
So
juicing or?
you can juice or you can make smoothies. It depends on what their other health conditions are as to which way I would recommend you go. If diabetes is one of them, it's a different thing. If they're post-cancer emaciated and we're trying to put weight on them, it's something different. So afterwards, if you want to talk to me about their specific problems, I'll give you some good ideas about what to do. All right, how about last? This is actually good. So this is called Izzy's. And so I give my patients 2 alternatives when they're looking to get off of soda, which is truly evil, soda. High fructose corn syrup, number 1, if it's regular, the diet products otherwise. Plus, it has acid in it that leaches calcium out of your bones. So soda pop is taking you towards osteoporosis every time you ingest it. It's got coloring in it that we know leads to cancer. There is nothing good that can come out of soda. Anything that people use to get battery acid off batteries, you know is not a good thing, right? Yeah, it's really bad for you. So the conversation that I have with lots of my patients is how do we get off soda? Because it's also incredibly addictive because of the high fructose corn syrup in it. So Izzy's are one of those things. Izzy's are made with real fruit juice and then mineral water. So it's still got the fizzy flavor like a Pellegrino or a mineral water mixed with fruit juice. So it is, for somebody like me who doesn't eat sugar at all, it's still too sweet for me. So I mix this with like a bunch of Pellegrino and a little bit, and then it's perfect. But for patients coming off of soda, this is about just as sweet as soda, so it tastes perfect for them. And it's a really easy choice to reach for because there's a lot of flavors and they're really yummy. So once we take that step down, then we start working on getting the sugar out. And there's another one called Zevia. Zevia, and I have these on a handout, which I can give you. Zevia is made with stevia. So again, it's a no-calorie alternative to diet soda that's made with stevia. So it falls into that same category that we talked about earlier. I'll just get your emails and email one to you. So the Zevia, no calorie, really great alternative to diet soda, but you do need to have it with food because you do get that insulin release, okay? So you're just going to see a lot of choices on there that talk about instead of having this, try this. So instead of rice, try quinoa. Quinoa is a grain, but it's very high in protein. Instead of having soda pop, try Izzy's, right?
Are you familiar with like a soda thing? It's not really a health thing, but called LaCroix? Because my wife was really addicted to Cokes, and she wanted to kick that. And when you talk about that Izzy, because it kind of has the sparkling water, so to speak, and it's flavored water. So I just didn't. I mean, I don't know enough about it. It may have some bad stuff in it still, but just wonder if you're.
I haven't heard of it, but that's exactly what you would go look for. You'd go look at the label and see. Is there a bunch of chemicals in here that I don't know what they are? Is there dye and coloring in there? I don't know what, Then that's how you know which category to put it in. Sure. So every day you're going to be faced with choices. You either need to be walking towards health or making the choice for disease and illness. Right? Everything you do is a choice in one direction or the other. And the choices you make right now are what are going to affect you for the rest of your life. So if you're working really hard for that day that you get to retire, you want to be healthy enough to enjoy your retirement. So if you do nothing else but start figuring out root cause, that is huge. You've got to stop pulling the check engine light on your health concerns because those are going to pick up speed and come back to bite you later. The people you see in their retirement out on the golf courses and enjoying their life, they're not taking a grocery sack full of medications. The people you see in the nursing homes getting their cup of medications delivered to them, yeah, there's a big difference. It's a big difference in quality of life. There's a big difference in how you feel overall. So getting down to root cause, that's the most important part of my message. And then the biggest thing that's causing a lot of the GI stuff are the foods that we're choosing. So get tested for the foods, and these foods that I've told you that are my number one offenders. Oh, I think I left one out, pesticides, and that is on your list there. There's a really great website, and it's on there, called ewg.org. That website lists not only all the pesticides and what the top 12 vegetables and fruits are every year that are the dirtiest, that have the most pesticide in them, but it also is a great place to check your makeup, your shampoo, your hair care products, because they will list every ingredient and whether it causes cancer or not. And you'll be amazed at some of the things that you thought were really good for you, like Neutrogena sunscreen. That was one that surprised me. I take care of people with skin cancer, and they've been told by the dermatologist, well, you have to wear sunscreen from now on. And they were using Neutrogena. So I looked it up to make sure. Neutrogena causes skin cancer. So not the best sunscreen to be rubbing on for a cancer patient. So that website is really good, ewg.org. You can look up everything from toothpaste to shampoo to sunscreens, as well as the worst foods for you.
You said EWG.org?
It stands for Environmental Working Group, and it's on the front of that handout. All right, so that's a lot of information. Anybody have questions? Okay.
How long did you have migraine?
Say again?
How long did you suffer from migraine?
20 years. Long time. Just to find out it was black pepper. Yeah.
So,
And they tried everything for me. Yeah, I'd gone on. I had to complete jaw surgery because my doctor told me it was because of TMJ. So I had my jaw broken in 9 places, my jaw wired shut for 6 weeks, thinking that would get rid of my migraines. I was serious about finding a cause for my migraines. Suffering through that and having it not get rid of them, that was pretty heartbreaking. Thank goodness now I know why, but yeah.
so once you got off the pepper, how long did it take for your migraines to go away?
3 days. Hadn't had another one since. Unless I go to a restaurant and I tell them I can't have pepper and they say, oh, there's none in there. By the time I get done with that meal, I'll know if there was. So I've learned. I have a medical card with black pepper on it. Say, go to your chef and make sure. This is not a maybe thing. I need to know for sure.
So what is this test that you're talking about?
It's a food sensitivity test. It is, there's IgE testing and IgG testing. So IgE is a skin test. That's most of what the dermatologists do because IgE is that superficial immunoglobulin that attacks things on your skin. So we don't rub a lot of foods on our skin. So IgE only tells you a little bitty piece of the picture. It will tell you if you put a food in your mouth, if it'll make your tongue swell or your mouth itch. But most adults have already figured those foods out. So getting skin testing for foods for an adult, I don't find that beneficial at all. In fact, I've seen lots of lists where they've been told all these things are fine, and then when we test them with IgG testing, they have a much larger list. So IgG is the immunoglobulins in your bloodstream, and we test foods with a blood test to figure those out. And that's the really great information that helps you fine-tune your diet to lower inflammation every time you eat. So I test for 184 different, I don't, the lab does, test for 184 different foods. And then when I get your results back, I'll have a list of these foods are okay for this patient, these foods are not, and how bad the reaction was. So we go through a process of removing those foods from the diet. And it is transformative. I have just seen miracles getting people's diet right. You know, little child with seizures, told that he was autistic, got his diet right. All of that went away. Just over and over and over again. Weight loss just gets so much easier. Insomnia. If you're eating something at dinner that's upregulating your immune system, of course you're going to have problems sleeping. So it's an amazing, amazing test. And you can't get to the information in any other way. You really can't. You know, there was 20 years ago before this test was available, people would have to eliminate everything, drink water for 3 to 5 days, and then introduce one food back into their life at a time. And that's how we used to get close to this level of information. But spices, you still couldn't figure out. That was a real problem because if you're introducing one food at a time, but there's spices in it, you have a reaction, you thought it was the food when it was the spice, vice versa. So the blood test just takes all that mystery out of it. It's fantastic.
Who gives this test?
There's a lot of different labs that do it. I draw the blood in my clinic and I send it to a lab called Allotest. That's who I use. It's rarely, if ever, covered by insurance, so you know. So that's why a lot of doctors don't do it. That's why you don't hear more about it, because insurance doesn't cover it. And if you haven't figured it out yet, insurance is all about sick care and not health care. When you're truly looking to get healthy, your insurance doesn't do near as much as you'd like it to.
So like, an estimate how much
$395. That's what it costs.
How much does it cost? That's why I asked.
That's exactly right.
Where's your office located?
I am off of Precinct Line in Glade, in, you know where Colleyville-Hurst area? Right over there. After driving here tonight, I can tell you it takes about 30 minutes. And the train certainly didn't help my cause any. If there are enough people interested, I could, bring a phlebotomist and we could actually do it as a group. So we could talk about doing that if there's enough people interested in getting it done. You could let Yvette know. Any more questions?
I just have a question.
Sure.
The $395, is that just the blood test, or is that the follow-up and recommendation and all that stuff?
That's just the blood test. That's just the cost. So if you come to my office and we have the office visits and all of that, it'll be closer to $600-700 by the time we're done, depending on what else you have going on, how sick you are, how much time we have to spend together. So if we do it here in a group, we can make that cost obviously significantly lower. I have to pay for my phlebotomist, but we could probably do it for closer to $450 if we get enough people. So it would save you all about $250 a piece to do it as a group. Here.
If we did it as a group, we would still get recommendations and everything.
Oh yeah. Oh yeah. I would have my phlebotomist come, we'd all draw, and then we would all go through our results together. Nobody else would see yours. You would have it in front of you, but we would be doing it here as a group when we went through results. And then we would all be going through it together, taking our foods out so you'd have each other to lean on. And then when it was time to add foods back in a couple months, we would all have a conversation about that together. We would just walk through it together.
What about the Neutrogena sunscreen causing cancer? I mean, what if that new Jergens lotion that sprays on that I really love has got something in it too? I mean,
That's why you go look.
does the test cover any of that?
It doesn't, but that's what that website is all about, right? So I can also test for environmental allergens. So that is a different test that looks for all the chemicals that are in our food supply. That's different. So you can avoid that by just getting chemicals out of your life.
Is that going to, ragweed hit a couple of weeks ago, and that was really rough.
Right. So
So, I mean, does that include that too, or is
I'm-
we just talking chemicals for
what the test we're talking about right now is just food.
Okay.
Just food. But
things you would ingest?
the huge win with allergies is, remember at the very beginning of the conversation, the 80 to 90% of your immune system is in your GI tract. So we get this area nailed down where you're not eating foods that disrupt this. Airborne allergies become virtually non-existent because you have the whole of your immune system working for you again, instead of 10 or 15% left that overreacts to everything.
That
So
makes sense.
it's huge. I mean, airborne stuff gets way better with this, even though all we're doing is changing the diet. But airborne stuff gets way better. Now, the chemicals are a different test. So if you're concerned about sodium lauryl sulfate and all the dyes and all of that, that's a different test. We can test for it, or you can just get it out of your life because it's bad for all of us. And what that website does is tell you whether it causes cancer or not, whether it's a known carcinogen. It's probably the best way to put that. So it also has things on there that don't contain carcinogens, so you can find hopefully a lotion that fits your needs. I don't know if it'll be Jergens or not. I haven't looked that one up, or I would tell you. Maybe you don't want to know. Ignorance can be bliss sometimes.
I got one. Which grocery stores do they sell that? Is he
Believe it or not, Costco sells it by the case, which is really great. Target carries it. Good. Walmart. Starbucks has them sometimes. Gas stations sometimes have them.
I know Chipotle has them.
Do they? Great. So Costco, Target, Walmart, a lot of places do. Zevia, a little bit less available. I know for sure Sprouts and Whole Foods and Central Market carry Zevia.
You mentioned something about honey I'm looking at
That's a great choice.
better?
It is. And raw honey is best because you get all of the great nutrients that come in honey when it hasn't been heat sterilized.
So how do you know if it's raw?
It'll say on the label. Mm-hmm. It'll say on the label.
So even though that says healthy, it's not, but raw is good.
Yes. Yes. Marketing people lie. And really well. They're really good at it. And they're really good at putting addictive chemicals in their foods that make your kids and yourselves crave them. Yes.
You mentioned something about dyes with students. I'm thinking as we have parents that try to look for alternatives. So you're saying dyes are bad in general, but students that may have attention
Yes.
hyperactivity, dyes are bad.
Yes.
Okay.
Yes. They will see an improvement by removing, and in general, things that raise the kid's blood sugar, it aggravates the brain. So that's why all of the processed foods make these kids' attention worse. So you'll often see when they come back from lunch, they're worse than before lunch. It's because their parents fed them a good breakfast, but at lunch they eat like crap, and their attention goes right out the window after lunch. It's processed food, food dyes, chemicals, MSG being high on that list as well. And I test a lot of these kids for food sensitivities, and I can tell you it makes a dramatic difference in their ability to focus, to get their diet right. So all the time people are asking me for alternatives to taking the meds for ADD, ADHD. Getting this test and getting their diet right, huge, huge. Are we done? No more questions? All right, so make sure I have your email, especially if you want one of these mailed to you because I didn't have enough, and I'll be sure and get it to you. And then I guess Yvette, you let me know, I need at least 6 people to bring a phlebotomist out here, so if you have at least 6 people that are interested in getting their blood drawn as a group, I'll bring a phlebotomist next time. We'll decide on a date. Okay? Excellent. All right. And so next time I'm going to pick another condition. I'm going to talk about root cause, just like I did today, and why not fixing it the right way is leading to fatigue, loss of energy, being overweight, and chronic illness. And that will be our theme. I'll pick new things to talk about. I'll rehash some of the important stuff. But we're going to go through chronic illness in ways that you can figure out what's really going on so you can start truly having a diagnosis and not just somebody medicating away symptoms. Because a monkey could do that, right? There's no art in that. It's figuring out what's really going on underneath. That's what we all need. Okay? So thanks for having me.